Okay, everybody had a quick break. Good. So yeah, I said we'll talk about some cases, and these are mostly cases where I want to sort of focus on the diagnosis and on spotting the cases because, this whole course is about zoonotic infections, and as we were talking about yesterday, it's important that people, clinicians on the front line, are able to recognize some of these conditions. So let's start with this case. This is a 39-year-old woman, and also some of them I'll go through slowly. Some of them will just be quick ones, just little vignettes. But I'm going to ask you guys to suggest what you think might be going on. So this is a 39-year-old woman who came to a district general hospital near Kowloon in Hong Kong. Okay, so it was in Liverpool, but this could be happening today in this city, with pain in the leg, which was shooting and radiated down the leg. And 4 months before this, she'd been on holiday in India, where she'd had diarrhea and she'd eaten some dodgy mushrooms. She'd been nipped on the ankle, a little bite by a puppy dog, and she'd had some testing of her bowel that actually was normal. So on examination in the hospital, she had a fever and a very painful left leg, which was flaccid with no reflexes, and she'd lost some sensation. And the rest of the examination was unremarkable. So what things are going through your mind about possible diagnoses? Oh, thank you very much. Warm in here. Is it getting warmer? Okay. Well, the heat is on you guys because this patient is in the clinic. Fever, pain in the left leg. She's just come back from India, and the left leg feels strange. So, any thoughts about possible diagnoses? And she's got a flaccid leg as well. Okay, I'm going to help you a little bit here just to get things warmed up, just because I want to hear from you. So, imagine she'd also had lesions in her hand and in her mouth and on her feet. What might you think of then? Enterovirus, yeah. So it's reasonable to think of enteroviruses causing flaccid paralysis. And there's one enterovirus in particular that we talked about earlier. So you don't see it now because it's been more or less eradicated by a vaccination. But yeah, polio is an enterovirus. So polio is a possibility. Any other thoughts from anyone else? West Nile is a possibility, and Japanese encephalitis virus is a possibility. So these all damage the spinal cord. Let's see what, has anyone heard of Guillain-Barré syndrome? Yeah, so that's another thing to think about. Have you heard of it? Do horses get Guillain-Barré syndrome? No, you've heard of it. Yeah, so it's a flaccid paralysis caused by the body's immune defenses. So this is what they thought in the local hospital. They also thought, could it be an abscess on the spine? Could it be a disc problem? She was in a lot of pain. They gave her morphine, and the scan showed no disc disease. She got worse, developed difficulty swallowing, and on day 8, she was lethargic. She had flaccid weakness in both legs and both arms. So they thought this was Guillain-Barré syndrome. So it's a post-infectious syndrome, Guillain-Barré. You have infection, your body fights the infection. In fighting the infection, it also damages nerves. They did a lumbar puncture that showed some cells in the spinal fluid. And but by day 15, she'd become unconscious. She had no oculocephalic reflexes. Her pupils were unreactive. The brain scan was normal, and they contacted me. So there was one thing in the history that they mentioned that worried me. If we just go back to the history. Go again. The dog bite. Yeah. Why did that worry me? Yeah. So rabies is on our differential. And they said to me, she's been bitten by this dog. We don't need to be worried about rabies, do we? And I said, yeah, I think we do. Because although rabies is known for causing a encephalitis, it can also cause a flaccid paralysis. And long story short, well, there are other rare neurological diseases that it could have been, but I said we need to be worried about rabies, and we did some testing. So the testing for rabies is the saliva or the skin or the serum, or the best is actually the skin biopsy here for rabies virus, and you can look for that. But we also did some barrier nursing, and we transferred her to our center because if it was rabies, there was some experimental treatment that we were going to consider. Anyway, she had a punch biopsy of the skin at the back of her neck. We did an MRI scan, which showed some interesting changes here in the medial temporal lobes, right there, and then also in the head of the caudate nucleus there, which are actually changes consistent with rabies. You don't get many scans, MRI scans of patients with rabies, but when it has been done, this is what it looks like. And then we sent off the biopsies for rabies testing. Here's the positive control. And you can see that this lady's saliva was weakly positive for rabies virus by PCR, and the skin was strongly positive. So sadly, this was rabies. And we sequenced the virus that we had, and it sat here on the phylogenetic tree, the family tree. And just actually close to another sequence that had come from India. I think it was the same year, patient that ended up in Germany. So this was confirmed to be rabies. By this stage, she was too sick for any treatment. So we withdrew treatment, any experimental treatment. We withdrew the supportive treatment she had, and she died. So she'd never had the hydrophobia, which is classic for rabies, or the aerophobia, which is fear of air, or the hypersalivation. So this is paralytic rabies. And the reason I wanted to present it, I think most people, if you saw real rabies, encephalitic rabies, you would recognize it because it's very characteristic. But paralytic rabies also worth thinking about in someone with paralysis. So we carried on doing skin biopsies, and you can see they remained positive. And on day 18 after she died, we did a post-mortem needle biopsy, and that was positive, as you can see there as well. And we did some antibody testing. So on day 15, the antibody levels were still low, and you can see one of the problems with rabies is you don't develop an immune response until very late in the condition, which is why people die from it. So she only, the antibody titer went up. And because this was in the UK, it made the national news. So it gives us a chance just to think a bit about rabies epidemiology, clinically, and prevention. Is anyone talking about rabies in the program? You had that yesterday. Okay. So this is revision. Right. Good. Who spoke on rabies yesterday? Okay. From Thailand but not here on the video. He came here. Oh, nice. Okay, right. Well, then let's do some revision. So where in the world, that's a better use, isn't it? I don't want to repeat what you heard yesterday. So you guys can, this is how you learn, isn't it? You heard, heard some things yesterday. If you have to repeat it, that it sinks in. So where in the world can you get rabies? First question. India, good. Yeah, anywhere else? China, good. You're on fire. You can get rabies in many countries in the world, as shown here. The ones in pale blue are said to be rabies-free. The ones in white are unknown because nobody's done testing. But even the pale blue ones, so the UK is said to be rabies-free. But actually, and Australia is said to be rabies-free. But there are rabies-like viruses in these countries. So in the UK, we have, it's called European bat lyssavirus, causes the same disease. In Australia, they have Australian bat lyssavirus, okay? This is the Daubenton's bat that carries the rabies-like virus, lyssavirus, in the UK. These are some of the other similar viruses that cause rabies, the disease. So this is quite interesting. Like I said, I'm not going to torture with the slides because you've had a session on it already. Do you know what the natural host is for rabies virus? Which animal hosts it naturally? Because bats, good. There you go. So the natural cycle is insectivorous bats. And then it spills over from them. It spilled over many years ago into terrestrial animals, dogs, raccoons, monkeys, and most human infections come from those animals. Okay, and here's India, lots of rabies in India. And like I said, even in Malawi, which was supposedly rabies free, once we started looking, we found it. And this is what happens. The virus enters after a bite and then is transported up the nervous system to the brain where it replicates and then spreads down through the nervous system. So as well as getting the virus from a bite of an animal, you can also, there's some very sad cases of people getting it from transplants. So if somebody dies from an unknown cause, because the cause is unknown. I mean, there've been a couple of cases of this, one in Germany, one in America. I think the German one, they found blood in their head, so they thought this person had had a subarachnoid hemorrhage, didn't take a careful enough history. I think actually it was a tramp or somebody that, anyway, they thought they knew why they died, did organ transplants. Suddenly the organ recipients start developing rabies. The reason is the first case, the person that they got their organs from had died from rabies without anybody knowing. So you have to be really careful if you're doing organ transplants that you know exactly why somebody's died. Okay. So the features, you'll have heard about the classical features yesterday, the itching, the insomnia, the anxiety, and then the encephalopathy, the confusion, and the spasms. And here's a patient having spasms from Thailand, actually. Did you get a bit of video yesterday? Did he show you some video? All right. Well, I won't show you mine because it's horrible. Okay. And well, let's keep going. This is paralytic rabies. So these are the symptoms our patient had. And this is the differential diagnosis. So other causes of paralysis. Okay. And you heard about how we diagnose. This is the skin biopsy. You probably saw a picture like that yesterday, I guess. Although most of the diagnosis is done by PCR now, but this is rabies antigen testing. Did he talk about treatment for rabies yesterday, about some of these experimental treatments? No, good, because they don't work. Long answer short. There's been 5 people well documented who've survived rabies, but they were given post-exposure treatment and then they were given it late or not given enough. So they developed rabies and survived. So they're not really treatment successes. They're really, they got the rabies, the disease, and they weren't really vaccinated properly, which is why they've got the disease at all. Because as you know, if you get exposure to rabies virus and you are vaccinated, the vaccine will protect you. So this was an experimental treatment that was given first to a woman in Wisconsin, and it was a bit of a cocktail. She survived, but she had bat rabies, not terrestrial rabies, and she may have even had antibody already. So hers was a very odd case. And she got a website. I mean, I would if I thought I'd survived from rabies. But every other time people have tried this regime, including here, this patient we had in Northern Ireland, they've died. So this was the treatment we gave to our patient, this cocktail of drugs. It keeps people alive for a bit longer, but you can keep people alive on intensive care forever on after rabies, but they don't recover. Yeah. And we did a publication of the 12 or so people who tried this experimental treatment and it didn't work. It doesn't work, so don't do it. Right. I'm guessing they talked yesterday about rabies vaccination. Yeah. So I won't show you that. I'll whiz through this one because you've covered it already. So let's go to, I mean, I'll just show this one just to emphasize the point that if you've had pre-exposure vaccine and then you get your post-exposure vaccine within 24 hours of your exposure to the virus, the survival is 100%. But the later you leave it, and if you leave it until you've got symptoms, then you won't survive. Okay, good. Let's move on. Did he talk about avoiding dogs? So, especially dogs, if it looks rabid, most people will keep away from it. Sometimes it's a lame dog. Sometimes it's a dog, a pet that seems to have something stuck in its throat because it's drooling. So then the owner tries to put their hand in it, gets a bite. Also, animals, keep away from animals, and especially animals which are usually wild. And then this one seems to be very tame. It's not running away from you. You run away from it. Okay. And in Sri Lanka, this is we talked yesterday about One Health. So this is a really good example of One Health because by vaccinating dogs in Sri Lanka, they've brought the incidence of human rabies right down. Because if the dogs don't get rabies, humans don't get rabies. Okay, this is just a pause to tell you that I think I mentioned earlier the Neurological Infectious Diseases course in Liverpool every year. This is your invitation to come and join us next year. We've had people from Hong Kong before. We've had people from about 30 countries now. Anyway, it's a lot of fun and it's mostly based around cases like this. Are you ready for another case? Okay. So this is a university lecturer from the UK who was traveling in China and 2 months into the trip became unwell with fever. She was in Yunnan province. She then developed a seizure. The seizures became intractable. She was treated with anticonvulsants and transferred to Bangkok, where she was found to be intubated. Even when the sedation was withdrawn, she did not wake up, but she did have flaccid paralysis. So coma and paralysis. This is what her scan looked like. It's just a bit swollen and tight. She had some tests, which were not very helpful, although the lumbar puncture did show there were some white cells in the CSF. So this is a patient who's presented in coma and fever. So I'd like you guys to suggest some diagnoses. We'll start at the back of the room. So fever and coma, just, keep it broad brush, very simple. I'm not after a pathogen. I'm just after a broad category. Anyone like to have a go? Yeah. She's talking to her friend. Do you want to shout out? Do you want to shout out? Yeah? No? Okay, you were talking about what you're doing for dinner tonight. That's fine. If you have any good suggestions, do let me know. Okay, come on, guys. Fever, coma, patient in fever and coma. What could it be? Yeah, encephalitis. Good. And oh, fine, we'll take that, encephalitis. And what type of pathogen might it be causing this encephalitis? Could be virus. Great, he's on a roll. So virus or possibly bacterial causes of a meningoencephalitis. So this is just a reminder, a differential, the causes of encephalitis in Asia. This was a study done in 2015. But you can see, we think of viruses, but there's a whole range of other pathogens, sometimes bacteria, as well as causing the meningitis. They'll cause the patient to have coma. Okay. She had some tests. These tests were negative for herpes virus, for some bacteria, for enterovirus. Again, enterovirus worth thinking about because she had this paralysis. And then she came to Liverpool where we found she had flaccid paralysis. This is what her scan looked like. So damage in the thalamus and basal ganglia associated with coma. Also, look at that. Can you see the white line down the front of her spinal cord? You might see it better on there. Yeah, you do see it there. So normal grey matter is grey, and then she's got this white streak of inflammation, yeah, at the front of the spinal cord. So there's one other test that was positive that I haven't told you about yet. and you can tell me. So this is a patient with encephalitis in China, affecting the brain and also causing a paralysis. Good man. What's your name? Pius. Pius, I like you. You can come again. You get the free place on the Liverpool Neurological Infectious Diseases course. Yeah, you only have to pay for travel and accommodation, but the place is yours for free, okay? That's not a joke. Send me an email. We do free places, actually, mostly for poor people in, Latin America and Africa. But yeah, I know you're a poor junior public health doctor, so you should come. Okay, so yeah, she had Japanese encephalitis causing the coma and the paralysis. And it was in the news because, if someone in China gets Japanese encephalitis, it's not news. But if it's somebody from the UK, it is. And she had not been vaccinated, which was a shame, given that she went to China every year for her work. And she's a patient of mine now, and she's happy for us to share this information. But and one of the problems is the advice says if you are going to Asia, if you're going for less than 2 weeks, you don't need the vaccine, unless you're going to an endemic area. That's for 4 weeks. But often travelers don't really know where they're going, especially young travelers, until they arrive. So these are 3 cases we'd seen in a couple of years. And, you can see they go all over the place. They don't know where they're going to go until they get there. Somebody says, hey, let's go to, Shanghai. So it's worth getting vaccinated. Good. We will skip through these slides because we talked about all of this earlier. This is the differential diagnosis for paralysis. This I'll just show you because, again, you may see patients with these scans, and this is a very characteristic finding for Japanese encephalitis and other related flaviviruses. So West Nile is related. The Australians have Murray Valley encephalitis related, and you can see the damage in the thalamus in all the cases, very similar. Also, this is the thalamus, including the basal ganglia. It's the part of the brain that gets damaged in Parkinson's disease. So these patients sometimes present with tremors. It looks like an acute Parkinson's disease syndrome. And again, if you see that, think about flaviviruses, think about Japanese encephalitis. Okay, that's about our diagnostics, which we talked about earlier. And we've covered the epidemiology earlier. So we shall move on. Our patient, this woman, did get some recovery and in fact got back to being a lecturer, sort of, gave a couple of lectures, but it was not a great outcome and she's permanently on a ventilator. So not a great outcome and not easy for her or her partner. And Japanese encephalitis virus has now spread to Australia. The virus is now permanently resident among the mosquitoes there. So it's spreading. We talked about disease control earlier. In theory, you could interrupt this cycle in all sorts of ways. But in practice, the only practical way of protecting against JE is vaccinating. And these are the vaccines. This is the one that's been available for a long time, wasn't being used, and is now being used in this one is the one that's now being used widely across Asia. This is a chimeric vaccine. So it's the yellow fever vaccine backbone with the Japanese encephalitis virus antigen inserted into it. Quite clever. Now, how are we doing for time? Sort of feel like we've got a bit of catching up to do, but we're sort of okay. I think we've got time for one more at least. Let me just have a look at the timetable. No, thanks. Sorry. Right, okay. I think again, talk about 5 minutes. Yeah, should we do one more case? And then I want to make sure people get their proper break before we move on, because, that's just the way I am. Otherwise, it spoils the next session. We need a break. I need a break, and I want to really learn about Crimea and Congo. Okay, so we'll do one more case, all right? Are you up for it? Are you up for it? Let me hear you say yes after 3. 1, 2, 3. Are you up for it? Good. Okay. So this is a woman who presented with 5 days of headache, fever, rash, and it was itchy. You can see she was scratching so much there. That's excoriations. Um, she had some joint swelling and difficulty walking and tingling in her fingers. And on examination, uh, although she'd had fever, by the time she came to see us, the fever was settling. She had this itchy rash, conjunctival injection, painless swelling of the lymph nodes, and her legs and her arms were a bit weak. And when we looked at the reflexes, they were reduced. In fact, they were absent. And she had some strange sensation in her legs and in her fingers. So, what did we say yesterday when we talked about recognizing things that might be a bit unusual? What's just in general, you see a patient, you think, what's a really important bit of the history that we should always think about, especially in our febrile patients? What's the one question we must always find out about them? Yeah, who said that? It's the vet. He's on fire. Who wants to come and do the course as well? Where have they? Yeah, exactly. Where have they been? Okay, where is this in the world? So, thank you very much. This geographical location, well, this next slide is what it is. I'm sorry for this. The geographical location was Brazil, and this is a picture of Carnival in Brazil. Possibly inappropriate for this audience, so forgive me. But so knowing it's Brazil affects what we do then in terms of thinking. She had the tests that we would do on anyone, including lumbar puncture and nerve conduction studies. And you could see actually, look at her hands now compared to back then. What do you notice? Look at the fingers there and now. They were swollen, yeah, and that was part of the joint swelling. So she had really nasty joint swelling. She had lumbar puncture and nerve conduction studies. And what did they show? My slides somehow are in a slightly different order. Anyway, the LP, never mind that. She did have some diagnostic testing done. So what viruses might we think of especially in Brazil? Zika. We talked about this yesterday. And have you had Zika here as well? I think you've had occasional cases. Not had a big outbreak yet in China. No, don't worry, you will. So her Zika was positive in the CSF and the serum and the urine. And in fact, the tingling that she had was due to Guillain-Barré syndrome. So she had Guillain-Barré syndrome caused by Zika. Put your hand up if you've heard of Guillain-Barré syndrome before today. Okay, a few people. Yeah. So this is this syndrome of paralysis following infection. This is the curve of cases in, yeah. So one of our studies, this was actually led by the Dutch, was looking at Guillain-Barré syndrome since 2000. And you can see it's pretty steady until 2018, when we have Zika virus and chikungunya virus, this overlapping outbreak, and a great increase in the number of Guillain-Barré syndrome cases. And most Guillain-Barré syndrome looks like this one on the left, which is a sensory motor loss. So they get damage to their sensory nerves and motor nerves, and they are weak and have tingling. I'm not going to tell you about the other ones, except to say there are variants, but the common one is the one you want to know about. And so this is a very expensive image of paralysis. And it's just to make the point that this is the nerve cell. So in polio, an enterovirus infection, and Japanese encephalitis, so when it's an acute virus infection, those viruses damage this lower motor neuron, this nerve that's going out to the limbs. But when it's Guillain-Barré syndrome and it's a post-infectious problem, what happens is it's the myelin sheath wrapped around the nerve that gets damaged. And that's why the clinical syndrome is different. And there are 6 pathogens known as triggers of Guillain-Barré syndrome, proven in studies, including Zika, as you've shown there. You also get it sporadically in other infections, but it's too sporadic to prove it's really the cause. But in these ones, it's been proven in case-controlled studies. Suspect Guillain-Barré when people have rapidly progressive weakness, and especially if it's followed a febrile illness, and diagnose it by doing a lumbar puncture and doing the electrical studies of the nerve in the arms and the legs. Sometimes they go to intensive care. We will treat if they are rapidly getting worse or they have autonomic or breathing problems, and we treat them with intravenous immunoglobulin and plasma exchange. And here is one extra bonus case. So this is another child who had flaccid weakness, and this was 3 weeks after a febrile illness. And this was unusual because the febrile illness was a febrile illness where you can see what the temperature is doing, goes up. You can see what the pulse is doing. And on this day, the pulse goes up a lot because the blood pressure, which was normal, has suddenly dropped. So do you know any febrile illnesses this is in Vietnam, so it's in this part of the world, which are associated with shock, with loss of blood pressure, and sometimes also with hemorrhage? A febrile illness with fever, hemorrhage, low blood pressure. Dengue. Yeah, thanks. Who said dengue? Brilliant. And this was a rare case of paralysis, Guillain-Barré syndrome paralysis after dengue. And finally, I'm just going to show you that here's the patient with another patient with fever, rash, and this one had encephalopathy because of dengue, altered consciousness. And finally, I showed you earlier a scan with the damage at the front of the spinal cord. That damage at the front of the spinal cord equates with these lower motor neurons at the front of the spinal cord being damaged. So for some viruses attack these low motor neurons and cause inflammation at the front of the spinal cord. And you can see it there, I think, very clearly, especially on that one, that white inflammation at the front of the spinal cord. Okay, so the take-home messages are take a history, especially a travel history. If something looks odd clinically, then think about, could it be a rare presentation of something? And we focus mostly on the causes of paralysis. Sometimes it's direct damage to the nervous system. If it's an acute febrile illness, then it's a virus damaging the nerves directly. But if it follows a febrile illness, then it's more likely to be this post-infectious inflammation of the nerves, Guillain-Barré syndrome. Thanks very much.